Uh, the etiologic agent is mucoral fungi. Mucoral fungi. They include many genus and many species: Rhizopus, Obsidia, Rhizomucor, and Mucor. This is the genera, not a species. It need or they need predisposing factor: diabetes, malignancy, antibiotic therapy, long term, malnutrition, for example, I vitamins, burn in a skin lesion, trauma. Uh, Mucormycosis has four type of infection: rhinocerebral, rhinocerebral mucormycosis, pulmonary form, gastrointestinal. Please attention in last disease. I know you are tired, but please quiet and attention. Pulmonary mucormycosis, gastrointestinal, and cutaneous mucormycosis. We have four types. The way of entrance the microorganism to body determine the form of infection. If the microorganism enter from nose, rhino means nose, you have rhinocerebral because infection starts from nose, infect the tissue around, and enter to eye, and after from optic nerve, like as aspergillosis, uh, go to brain, and it is very dangerous for in compared to aspergillus. It is very dangerous form in mucormycosis, especially in diabetic person and patient. Pulmonary mucormycosis, the entrance is inhalation, respiratory system. Gastrointestinal form, when you enter the microorganism orally with food or water. Cutaneous form, when you have injury in the skin, in burning, in trauma in the skin, it show, or sometimes surgery, suture in surgery, enter the microorganism. We have four types of disease. Mucormycosis was important in COVID-19 as black fungi. Black fungi lead to many mortality, many death in uh, COVID-19 patient. Because in this infection you use some corticosteroid, and the spore exists in respiratory system and add to COVID-19 inflammation. It add, and the patient show a complex infection without any effective treatment. It lead to death of many people. Yes, yes, yes. Uh, uh, okay. In rhinocerebral, the infection enter the nasal sinus, paranasal sinus, and go to the neighborhood tissue, oral cavity, and eye and face. In this patient, you can find the lesion in palate, soft palate, and hard palate of oral cavity. Or in patient, go to eye. When the eye involved, we must empty the eye because it to blindness. Or in this patient, oral cavity and nasal cavity. The patient go to when the infection involve the brain, you have the CNS sign, headache, and after coma. In patient, show the coma and the surgery that have before lead to uh, blindness. May you find uh, imaging, radiography, scanning, or sonography, CT scan. Uh, Skin lesions sometimes occur and involve in trauma, in operation, suture, or each trauma add may add the spore on damaged tissue and continue fungal infection. In gastrointestinal mucormycosis, usually we have a patient that use long term of antibiotic, antiseptic, anti acid, anti-acid for long term. These prepare the condition for growth the microorganism in GI tract. You must diagnose the mucormycosis as soon as possible. It needs a fast diagnosis. Or sometimes without any laboratory diagnosis, the physician start the treatment. When you when you suspect to infection in patient, in diabetic patient, in uh, cancer, in I mentioned the process poison factor. When the physician suspect to rhinocerebral mucormycosis, start the treatment without uh, laboratory report. You must start fast the treatment because it is very uh, dangerous and spread to brain. There isn't any detect time. May about 1 week. How we can detect? We cannot with clinical sign, but because there are risks for death, we must start with historical. With history, we must start treatment and prepare the sample, transfer to laboratory. Until we cannot wait for answer the laboratory. We must start because it is very dangerous and it's, high speed go to brain. We must start the treatment and we send the tissue material, CSF, tissue, nasal tissue to laboratory or eye discharge to laboratory, but we start the treatment with history and clinical sign only. In microscopic in a laboratory, we must search for mycelium. Which mycelium? Non-septate mycelium. It is very important. At first, we must decide for mycosis. Yes, I see mycelium. It is mycosis. Which mycelium? Mucormycosis is a dangerous and fast infection, fast spread infection. We must at first diagnose mycosis. Second, which mycosis? Septate or non-septate? Non-septate mycelium. It show mucormycosis and reported result.
How we can differentiate between the type of the mycelium? Because all the types septated or not septated.
When usually mucormycosis show non-septate and usually Aspergillus septate. For treatment of aspergillosis, we have time for waste, but for mucormycosis, not. And the differential is attention to septum. Septum. There isn't any septum. Mucormycosis is suspect. Why? Uh, how we determine the mucormycosis? With culture. We must isolate the colony. This is non-septate until 99% we decide for mucormycosis and complete with isolate the mucorale species from media.
Does we have another type that doesn't have septum?
No, 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 only mucorale, only mucorale, only mucorale. This is a colony. When you isolate this colony, the complete, your diagnosis is complete. Mucor mycosis. It is mucorale colony of Rhizopus. Rhizopus is a genus of mucorale Rhizopus. You must know it is mycology. Therefore, it is important decide decide of mucormycosis, aspergillosis. Aspergillosis with septate mycelium until 99% probability and complete with isolation of aspergillus from media and non-septate mycelium for mucormycosis with any mucor species. It is not important. Non-septate. It is a histopathological aspect of mucor without any septum. Any septum. It is a colony. It is a colony of mucor. It is microscopic observation of mucorale, sporangiospore, sporangiospore. It is a key for diagnosis. It is a schematic slide of mucormycosis, sporangiophore, sporangium, sporangiospore, and treatment. For treatment of mucormycosis, you use amphotericin B and controlling the predisposing factor. Not only for mucormycosis, the other fungal infection. In addition to drug treatment, you must control the predisposing factor. If you have diabetes, you must decrease the level of sugar in blood. You must control it because after you finish the treatment, the infection show recurrence, and you again see the clinical sign. The control of predisposing factor in opportunistic mycosis and amphotericin B or azole for treatment. In last slide, we have summary. Mucormycosis is a systemic fungal infection caused by member of Zygomycota or Zygomycete or Mucoralha You are tired? The class zygomycete consists of septate, aseptate hive, patient contracting this infection, uniformly suffer from paralysis factor, acidosis, uncontrolled diabetes, HIV, malnutrition, and immunosuppression. Rhinocerebral mucormycosis is the most common form, usually seen in patients with, uh, with diabetes. We finished the theoretical class for you. We have a time for practical, and in next theoretical class, uh, Professor Dai present the superficial mycosis for you and some opportunistic mold, aspergillus, mucor, in morphology diagnosis. You are welcome.